Hey y'all! I received many questions regarding my feeding tube, like what types of feeding tubes I've had, what the placement entails, how the surgery felt afterwards, yada yada yada. It is way too long to fit into one single blog post, so I figured I would make a video with my answers. Oh, and check out these adorable Halloween pumpkin lights. I had to record at least one video next to them because they're so cute. The first feeding tube I've ever had was back in 2010. I was 13 years old at the time. I'm 20 now, if that helps. It was an NG tube and it goes into the nose, down into the stomach. I did not use it for tube feedings. I had it after my Nissen fundoplication surgery for draining. I was completely asleep during that placement. I was awake for the removal, but honestly I hardly remember it because I was so out of it. The first tube I had placed to receive nutrition was an NJ tube. Now an NJ tube goes into the nose, down the esophagus, through the stomach, past the stomach into the duodenum, which is a portion of the small bowel, and into the second portion of the small bowel called the jejunum. Before I continue, let me preface this by saying the type of symptoms I was having prior to having the tube placed was severe nausea. I could not actually vomit because I had had a Nissen fundoplication where they take part of the stomach and they wrap it around the esophagus to prevent reflux and throwing up. So I was having the severe nausea, diarrhea, alternating with constipation. And sometimes I would go 3 weeks without using the restroom. And then other times I would go 20 times a day with blood and everything. So that was intermittent. Of course, I was having my POTS and EDS symptoms and pain. I was not having full-blown mast cell reactions. Years before then, my doctor had wanted to tube me. I did not have a diagnosis at that time. All that we knew is that I had too many mast cells throughout my GI tract. But we weren't factoring that into my symptoms because my symptoms were not obviously allergic. So instead of tubing me immediately after I dropped 25 pounds, the GI doctor decided to send me to the Mayo Clinic because we were looking for another GI type of explanation for my symptoms. And at that time, I was not ready to accept that I needed a feeding tube. I was not at that stage of my illness yet. Years later, after I had finally had enough misery, she decided to place an NJ tube for feeding rather than an NG tube. Most people start off with an NG tube to try feeds in the stomach first, but because I had previously been diagnosed with gastroparesis, which is a paralyzed stomach, we opted against that and went straight to the NJ tube. My weight was low, but it was not critical. I was fainting and blacking out quite often daily. My basic metabolic panel and CBC labs appeared pretty good. My albumin and pre-albumin, which are nutritional markers, were fine. My iron was low and the occasional electrolyte issue. But aside from that, they looked fabulous. They did do further stem testing that did prove that I was in starvation mode. For the placement of the NJ tube, I went to interventional radiology. I lay down on a table with a fluoroscopy, x-ray, looking at my stomach there. And what they do is that they take the NJ tube and usually they will place some kind of lubrication jelly on the end and they'll slide it in your nose. And once it gets to your esophagus area, they'll tell you to swallow. Now, with mast cell problems, the lubrication jelly can be an issue. During my first placement, my mast cell disease was not nearly as progressed. I was able to use the lubrication jelly to make it more comfortable, but my other placements after that, once my mast cell was more progressed, I was not able to use the lubrication, and they had to simply wet the tube with sterile water after feeding it up into my nose. The placement for that is definitely uncomfortable. Your eyes will water, you might heave a little bit, but you just say yo dude, let me have a break, and usually the radiologist will stop, let you regain your composure, and then he'll continue. The two problems that I encountered when I was getting my NJ tubes placed, one was that there was difficulty getting the tube past the pylorus, which is the opening of the stomach. Again, I had gastroparesis, which is a paralyzed stomach, so my pylorus wasn't opening like it should. So that kind of held things up for a while. But to bypass that issue, The radiologist said the trick was to start thinking about food. Once you think about food, that triggers your stomach to prepare for digestion, and it'll make it easier for the tube to go through. And so that's what happened. I thought about a muffin, and he got it through. It was the first placement, or there was a second placement, because I've had multiple NJ tubes. The radiologist did start putting the tube down the esophagus, and it went down the wrong entry. It went into like the airway. I felt like I couldn't breathe, but we quickly pulled it out and restarted, and all was well. To take the tube to the side of your face, the nurses will probably put skin prep down right before they put the tube there, and then tape it to the face. That makes things stick better, so the tube doesn't try to come out or fall off, or the tape fall off. I had a skin prep allergy that I was not aware of that first time, and so I received a lovely chemical burn on my face, sorting that around until it healed. After the placement, it was like choking on a giant spaghetti noodle. I heaved for quite a few hours until my body adjusted to that feeling. Swallowing would kind of trigger the gag reflex, so spitting my saliva out into a cup, although that sounds gross and TMI. 24 hours later, I had a sore throat. Now, this was the absolute worst sore throat I had ever experienced in my life. It was worse than any virus, flu, strep. It felt like I was literally swallowing needles. I toughed it out because people had said that your throat can be sore. And a week went by and there was no improvements. It just kept getting worse. So I pulled that tube out myself at home. I was terrified to do it. I had a friend talk me via Skype through the whole process. It was gross. Now, stomach contents do come in contact with your nasal cavity as the tube is being pulled out. And that smells disgusting and it might burn, but wiping the outside of the tube with a washcloth helps get all that nastiness off. So that tube was pulled out, but I needed nutrition. So what we did was my doctor scheduled another NJ placement, but instead of doing a 10 French, which was my first tube, we decreased in size to an 8 French. That is definitely pediatric, but worked like a charm. Removing that tube went well. The new placement also went well. The pain subsided almost immediately upon removal, and it never returned once we went down to the smaller size. One trick I found out to help with some of the throat pain is a mixture of Maalox and Benadryl swishing like a mouthwash. Others claim that the nose can be sore from the NJ tubes. I did not experience that. I had no nose pain whatsoever. How long before symptom relief? Aside from my throat issue, I had felt amazing the very next day with the first NJ tube. I stopped blacking out and fainting as frequently. It increased my quality of life immensely. It was so much so that the GI doctor scheduled the surgical placement of my GJ tube only a month later. The NJ tube is an amazing tool if you temporarily need nutrition and you can go back to eating rather quickly, or if you just want to see if you're a good candidate for the surgical tube. Because if you don't do well with NJ tubes, then it's likely having the permanent GJ tube placed won't be successful either. I had no problems with any of my NJ tubes other than my throat. They have never flipped. And it helped me feel a lot better. I was terrified, but it's nothing to be afraid of. Any discomfort is very short-lived and it's over before you know it. And you're moving on to get nutrition. More so than the NJ questions, I received questions about the surgical GJ. Now, the GJ provides access to both the stomach and the intestines. It is one tube, but there is a portion of that tube that branches off that is threaded past the stomach and into the jejunum. So most people feed through the J and then use the G portion to vent stomach contents out. Or you can trial feed in the G2 as they are tolerated, but I personally have not tolerated them ever. I have actually had 2 GJ surgeries as I went through a 10-month remission spell where I pulled the first one out and the stoma had healed over. I received a lot of questions about the pain I experienced afterwards, and neither of my GJ placements were the norm, so I do not feel I can accurately convey like the typical experience, because all I have is what I've experienced, which is not the norm, and this does not mean any of this is going to happen to you, but I'm just sharing what I've been through. Normally the surgeon will place a long tube and then wait 6 to 8 weeks for healing and then replace it with a low profile button. The reason being is it is difficult to determine button length. Appropriate sizing cannot be determined until some of the swelling has went down from the surgery and healing has taken place. You can adjust the long tube from the outside, which is why it is a better option initially. However, I was 16 in vain when I had my first GJ placement. I didn't want the ugly long tube. The surgeon had never placed a GJ before, and so he was very easily convinced to do the button right off. During the surgery, he had to open multiple button kits, obviously because it's difficult to determine the sizing right off. Once he would get the GJ button in and the J portion situated into the proper location in the small bowel, he would go to inflate the balloon that holds the tube into this between the stomach and the abdominal wall. And he would notice that the button length was the incorrect size. So he would have to pull the whole J arm out of the new stoma. He would then remove it and try again with a different size button. And that happened a couple of times. The repeated attempts of removing the tube in and out of a new stoma ended up bringing intestinal contents that would soon infect the brand new stoma wound that was to be my... I awoke to a stitched 16 French 2.5 centimeter Mickey GJ button. I was to be admitted overnight for observation just because I was a complicated case. Afterwards, I was very nauseous. I remember dry heaving, being wheeled back into the room. They gave me Zofran for that. Although I was dry heaving, I wasn't able to actually vomit because of my Nissen fundoplication, like I had said before. The pain that first few hours was bearable. It was way better than my Nissen fundoplication surgery pain. It felt very similar to doing sit-ups or other abdominal exercises. I was just kind of walking hunched over like an old man or something. But I alternated between Toradol, which is the IV equivalent of Motrin, and Tylenol. This first surgery, I was not having full-blown mast cell reactions. I was able to do the IV instead. I was even taking oral meds at that time. I now have a very, very, very severe NSAID allergy, but I didn't then. The pain that was most surprising after my first GJ surgery was that I felt the area was spasming. I thought it was a muscle spasm. Now I realize that that was just the body's natural response to GI motility. Since the tube is threaded throughout the GI tract, the body tries to digest it, and so that will cause the repeated sucking in motion that feels similar to a spasm. But when the stoma is new, that hurt quite a bit. What's kind of funny is that the pain I was complaining the most about immediately after my GJ surgery was from my eye. They sometimes tape the eye shut during surgery, and when they did that, my eye wasn't completely shut, so when they went to remove the tape, it also ripped off a portion of my eye. I pretty much just held a wet washcloth to my eye for hours, but once the eye doctor came in, he fixed me right up. In a few days, my eye did heal. Less than 24 hours following the GJ surgery, I started running intermittent low-grade fevers. I was told that it was normal to run fever after surgery, even though I knew it wasn't my normal because I had not had that happen during my previous surgeries. I also noticed a lump near the tube site. I was told that it was just swelling. After that, I was discharged. The pain grew increasingly worse. I was still on a regimen of Motrin and Tylenol, except then it was not IV anymore and it was orally or through my tube. The fever continued to increase. It got over 102 even with the Motrin and Tylenol. I had to take a codeine to decrease the pain enough to get to the ER. Once it hit 102.3, my mom said it was time, even though I begged her not to go to the hospital, which I'm very glad I did because I needed to go. The surgeon was called into the ER He removed the stitches, and then that kind of moved the lump that was next to my stoma, and then out came a bunch of foul smelling pus, which was the infection. They cultured it, and cultures came back showing it was Enterobacter cloacae. That type of bacteria is derived from the gut, and it was due to pulling that new tube in and out during surgery because of the sizing problem. I was admitted again for 12 days for IV antibiotics. Once I got my first dose of antibiotics, the pain significantly improved and felt like normal. By week 2 out from surgery, I was getting around, and by a month I was completely back to normal, even with my infection complications. Placing the button initially not only led to my infection problem, but it also led to a leaking problem. The longer I had the tube, the more profusely it would leak. It was to the point where I could eat or drink something by mouth and then it would pour out onto the floor. I had severe burns. I changed brands of tubes from Mickey to AMT. It did not help. I changed from a GJ to a G tube because once I got to the 1.5 year mark, I went through a 10-month remission period. I thought I was practically cured. Even the doctors thought so. While I was still on medications, I was eating over 2,000 calories a day, exercising, functioning great. I was doing so well that I wasn't using the tube for nutrition, so instead of waiting a year with just a G to keep the stoma open in case I relapsed again, I just decided to pull the tube out completely and allow the stoma to heal over because I was tired of dealing with the severe burns. We just pulled it out and placed nothing in the stoma. No surgical intervention was required to close it, even though I had had it for almost 2 years. The top portion of the stoma healed quicker than the internal portion, so food kept trying to leak out and it would pop the top of the healed stoma open. That happened quite a few times until eventually it healed completely, and then it looked like a second belly button. 10 months later, I got bad again. I needed another tube. Now this was during my 8-month admission. My mast cells were out of control. They had placed an NJ in the meantime, but we knew I was likely going to need a long-term solution, and it is not good to keep the NJ tubes in indefinitely. So I already had to undergo 4 other procedures, and they only wanted to put me under general anesthesia once. So I had my GJ tube placement, my first ever Hickman line placement. I had a bilateral bone marrow biopsy, 2 GI biopsies, and I think there was something else. Anyways, they went ahead and placed the second GJ tube in the same spot as the old one had been previously. He kind of just reopened the old stoma. The pain from GJ number 2 was hardly anything. It was barely sore. It was much less intense because the stomach was already attached to the abdominal wall from the previous tube. So I would rate the pain from the second go around a 1 out of 10. While that pain was minimal, thankfully, the pain from my mast cells being triggered after that surgery from having multiple procedures done at once, along with like general anesthesia, was immense. It was terrible. My spleen swelled and was trapping my cells. I was unable to take in a full inhalation because of the spleen swelling, so my oxygen was low. And all over, I just kept going in and out of reactions. I was unable to take any pain medication afterwards other than the 1 dose of fentanyl that I had in surgery. My muscles were already triggered to the point where if I took anything extra, it would only contribute to my pain because I would react to it rather than helping anything. GJ number 2 was done the right way. Hindsight's always 20/20, isn't it? We placed the long tube first. We waited 4 weeks for healing, and then we put in a button. We used the same size as I had for my first button because we just assumed that was what size I was. But once I got my button, I started having leaking issues again. I noticed that the tube was sticking far out, so the size was reduced. We kept reducing the size until the leaking problem resolved, and eventually we got down to a 16 French, 16 French 1.5 centimeter button, and there was no more leaking issue. The GJ tubes do need to be replaced and switched out every 3 to 6 months, but you keep the same stoma. And since the stoma is healed, that causes no additional issues. Now, when I get my replacements, I've made a video on this before, but they just check the placement by injecting air rather than contrast dye, because contrast dye can lead to mast cell reactions, because I have known issues. And they do not use lubrication, kind of like with the NJ. They can sometimes use lubrication for the abdominal tubes too, and we just omit that part and go with wetting it with some sterile water first. I did experience complications, but the GJ tube is the best decision I've ever made. It increased my quality of life tremendously. If anyone has any questions that I did not answer, you can comment them down below. Don't forget to like the video, thumbs up if you liked it, or thumbs down if you didn't. And thank you for watching.